In this final episode of our documentary series, we'll explore how Black communities have historically and continue to advocate for our own health and well-being. Despite facing immense challenges, Black communities have developed innovative and effective ways to address health disparities.
THRIVE stands for Transforming HIV Resentments into Victories Everlasting Support Services. There's a difference between just living with a thing and thriving with it. You know, I'm not just acquiescing to this place that I am, but I am owning where I am and transforming it and making it into everything that I need it to be. Sometimes when I hear concepts like the social determinants of health and health equity and harm reduction and all of these really amazing concepts, I glaze over and I get a little angry because I feel like those concepts are being used to disenfranchise my community. You know, that these things are being placed in books as opposed to being placed on podiums and pulpits that are accessible to my community, because we want to make it a class conversation. We want, like, you know, the people who read these types of books, the people who can decode white papers, are the people who get to know about the things that are important to their lives.
Cultural relevance, right? It's being able to understand that not everybody's going to think or operate like you, right? Not everybody's going to make life decisions like you. Not everybody is going to engage in the same habits or spaces as you. That being said, if you're going to center a community, you have to really understand who the community is. Like, who are the people that make up this community? What's happening? What are they doing? What are the spaces that they're engaging in? And doing that in a way that is very humble and non-judgmental.
It's a community approach. If I'm not sharing it with you and you're not sharing it with others, then the message is not going to be spread.
Our communities have shown resilience and resourcefulness, ultimately creating community-based organizations and initiatives to address health disparities. By prioritizing and centering the voices of those most impacted, Black-led organizations are making significant strides towards better health outcomes for our communities.
The Black Panther Party created a sickle cell movement. We know that this is a health issue that impacts predominantly Black people. So it wasn't on anybody's radar. But they started providing both the education and the medical needs of people with sickle cells, and ensuring that Black communities was informed, aware, knew what to look for, knew how to access the services that they had. And what that model says to me, even before the shoe, that this is for us, by us. That's the FUBU approach. There are initiatives across the Southeast that may not get a lot of recognition, but Black people are taking the lead and they're taking the stand to ensure we're not waiting on a great white hope. We're not waiting on anyone. We are taking control of our own needs, our own sexual health, our own wellness.
Top-down messages don't work. Messages from public health officials who are not connected to communities are often going to miss the mark in terms of communicating what's important. I think that this project is an example of how to do that by connecting community with people who are trusted voices, who can communicate the information, and empower community members to not only think about these things differently, but to act. And that, to me, is the critical piece of this. I think it's also incumbent upon health funders, health departments, health agencies to fund community groups and organizations to do this critical work, because clearly they aren't doing it well. So why not give resources to the community groups that are actually able to do this and able to get out messages that will land well and will be heard in the way that they're intended.
The fight for health equity is ongoing, and Black communities will continue to support each other and demand better from our healthcare systems. By working together, we can create a healthier and more equitable future for our communities.
Collaboration is so important, and if we had to do a hierarchy, which I don't think that there's any value in really valuing a hierarchy, the community would be at the top of the list. You know, that like an MPH, a DRPH is very nice, but that is not gonna achieve health equity for us. And that's a tool that we add to community, that we add to other tools that we have in our toolbox, and that's how we approach the response.
At Thrive, you know, what we do is not just providing services. What we're doing, we're trying to empower people by allowing them to advocate for themselves. We're trying to educate people so that they know what's up. We were able to center our folks in a way that they would not have been centered otherwise. You know, a lot of persons turned to us because they were turned away by their health departments, or they were sent back, or said that they weren't necessarily eligible.
Cultural humility will be key in the relationship with providers and with our community in addressing from a top-down approach our access to both prevention services as well as medical models and strategies for us to increase our wellness.
As soon as community groups started mobilizing and creating vaccination sites, and folks understood that this was where that they could go to get the vaccine, and they felt comfortable because this is a, you know, Thrive SS, this is a community organization that I'm familiar with. I go there for other things, and, you know, I go there for other services. So I feel comfortable coming here to get a vaccine, as an example.
As we conclude, we have seen how the legacies of slavery and colonialism have continued to shape the social, economic, and political landscapes that impact Black health outcomes. We have seen how Black communities have historically fought for their own health and well-being, and continue to do so. Black organizations and Black-led community initiatives are the key. But there is still much work to be done. Black communities continue to disproportionately be affected by HIV, Mpox, COVID-19, and other health disparities. We must continue to address the systemic and institutional barriers that impede health equity for Black people. This includes advocating for affordable and accessible healthcare, addressing poverty as well as economic inequality, and ultimately confronting the stigma and discrimination that still surrounds many healthcare conditions. We must continue to also support and uplift Black-led organizations and initiatives that prioritize health equity for our communities. We have seen how community-based efforts have made significant strides in addressing health disparities, and it is up to us to continue to amplify these efforts.
One thing about Black communities is we will buy into a vision if we believe it.
We really just want to be a part of the conversation. We really just want to be at the table, not cleaning up the table after everyone's eaten.
So I think it's really important that we recognize our power and operate in and move in it.
Join us in our efforts to achieve health equity for all. Together, we can make a difference. Together, we can create a future where health equity is a reality for all. Thank you for watching.